Thank you very much for joining us tonight, and thank you as well for all the people who are following us on our Facebook Live broadcast. So we have standing room only here. There's over 200 people in the room, and countless others joining us from across the province and across the country. So thanks very much to all of you for joining us. We have a 90-minute session here. We're going to go straight through without break because we know lots of you will have questions. We have lots of interesting things for you to listen to. But many of you, like me, are living with one form or another of arthritis or other musculoskeletal condition. So we want to make sure to remind you it's totally okay to get up, stretch, walk around, grab some refreshments if you need to during the session. You don't need to stay glued to your seats. Do what you need to do to be comfortable, okay? There are refreshments at the back, coffee, tea, water, healthy snacks, washrooms in the back corner. An introduction. Sorry, my name is Douglas Emerson. I'm the Senior Manager of Communications at the Arthritis Society. We're hosting today's event with the support of our friends and sponsors at Aphria, so a shout out and thank you to them. I see our friend Rachel here. So we have 5 speakers joining us today to walk you through the ins and outs of medical cannabis and its use in managing chronic disease, and in particular arthritis. You'll be hearing from Dr. Christopher Blue, who's a medical practitioner and prescribing physician here in Windsor with a couple of different practices. He'll be followed by Lauren Meadows, who is a patient advocate from Leamington, a young mom who's going to share with you her story of living with rheumatoid arthritis and how medical cannabis has played a role in her care. Fabio Costante, who's a practicing employment lawyer here in Windsor with Massot DeLuca McPherson Prince LLP. He's going to talk about the roles and responsibilities of employers and employees when dealing with medical cannabis in the workplace. Janet Yale is the president and CEO of the Arthritis Society. She's come down actually from Ottawa today to join us and share some of the work that the Arthritis Society has been doing in this space and explain why we're the ones hosting this event. But to kick it all off, I'm pleased to welcome joining us via Skype from Halifax, Nova Scotia, Dr. Jason McDougall. He's a professor at Dalhousie University, and Dr. McDougall is going to give us a quick walkthrough of Medical Cannabis 101 and an update on some of the recent advances in the research sphere. So let's see if we can bring up Dr. McDougall. Can you hear us, sir?
I can hear you. Can you hear me?
We can. I can. Yep, we're good in the room. Yes. So we'll, with that, we'll turn it.
If it's all looking pixelated, don't adjust yourself. It's just my shirt.
I will say, just before you start, Dr. McDougall, there will be an opportunity for questions at the end of all of the presentations, so hold on to your questions. If you don't want to ask it live, there's pen and paper on each of the chairs. You're free to fill it out, drop it in the box at the front of the room there, and we'll answer those at the in the question session once our speakers have finished, and there will also be an opportunity to ask questions live if you wish. We'll also be answering questions from our followers on Facebook Live. And at the end of the session, if you can fill out the survey, it helps us learn how to do these better, give you more of the answers and information that you need. We'll come back to that at the end. So with that, Dr. McDougall, you're free and clear to go ahead.
Great. Well, thank you very much, Doug. Thank you to the Arthritis Society and to Aphria for sponsoring this event. I guess I'm charged this evening with maybe introducing you to the world of cannabis and specifically medical cannabis as a potential treatment for arthritis. So I'm a professor of pharmacology and anesthesia, so I know all about the drugs that can put you to sleep. But I also chair the Scientific Advisory Committee for the Arthritis Society when we review anything science related and grant related with the society. Okay, so let's get going. So what actually is cannabis? Well, it's a flowering plant, and there are 3 different species of cannabis. So we have Cannabis sativa, Cannabis indica, and Cannabis ruderalis. And the flowers of these of the cannabis plant, you see, can produce these beautiful resin-filled what are called trichromes, or little glands that are associated with the flower. There are actually over 500 different chemical entities, so it's a very complex plant. 500 different chemical entities that are found within cannabis. Some of them are things like cannabinoids, and we'll talk a little bit about the cannabinoids a little bit later on. There are various terpenoids within the cannabis plant, and that's what's responsible for giving some of the different odors and the different smells associated with cannabis, and they may or may not have therapeutic value. And then there are various different what are called flavonoids, and that's what's responsible for giving a lot of the different colors associated with the cannabis plant. So if we think about the cannabinoids, there's over 100 different types of cannabinoids. Some of them you may be familiar with, some of them maybe not so. The classic one that we often hear about is something called delta-9 THC, or tetrahydrocannabinol. And this THC is the main psychoactive component that's found within cannabis. It's the chemical that is responsible for the euphoric feeling of taking cannabis. It gives you some of the highs associated with it, but it does have other therapeutic values associated with it as well. Another chemical that you may hear quite a lot about is something called cannabidiol. Cannabidiol doesn't actually produce any sort of highs. It's a very safe chemical, but it has a lot of beneficial effects for treating chronic pain conditions such as arthritis. So these cannabinoids are found in oils which are secreted by these trichromes, these small parts of the flowering plant that contain those cannabis producing compounds. So we can think of cannabinoids as being broken down again into three different groups. There are what are called phytocannabinoids, and these are the ones we've been talking about, the cannabis-like compounds that are derived from the cannabis plant itself. We can actually take some of those molecules and try and synthesize them in the laboratory, and these man-made cannabinoids are called synthetocannabinoids. And then finally, there's a whole group of cannabis-like compounds that are produced naturally in our body itself. So we may be familiar with the endorphins and the endorphin system. We actually produce our own types of cannabis in our body as well, called the endocannabinoids. There's a chemical called anandamide in our bodies, and anandamide derives its name from a very ancient Sanskrit word, ananda, which means pure bliss. You may come across, so we talk a little bit about some of the pharmacology of cannabis. There are two cannabinoid receptors called CB1 and CB2. So cannabinoid 1 receptors, they're generally associated with nerves, so they're very prevalent in our brains and in our nervous system. And really those are the receptors that are going to be ideal to target to try and reduce certain types of chronic pain. You may come across other type of receptors called CB2 receptors, and these receptors tend to be associated with the inflammatory cells, like our white blood cells in our body, and really indicating that cannabis could have some beneficial effects in alleviating inflammation and improving immunity. So these are the two basic type of receptors that cannabis molecules can actually bind to in our bodies. So what about prescription of cannabis and cannabinoids? Well, there are many different things on the formulary, many different tablets, many different capsules that contain cannabis-like molecules. So for example, there are things like dronabinol and nabilon, and these are oral capsules that contain man-made or synthetic type of THC in different sort of concentrations. And the formulary has approved these drugs for treatment of things like chemotherapy-induced sickness and vomiting, as well as anorexia associated with in patients who have HIV/AIDS. Other type of prescription cannabinoids that you may come across are things like that have the wonderful name of biximols, They are, for example, a drug called Sativex. And these nabiximols are a combination of THC and CBD in a 1-to-1 ratio. And this is an oral mucosal spray, so you can spray it underneath your tongue. Some of the side effects associated with these nabiximols is patients can complain of feeling a bit drowsy, maybe some dry mouth. And it's been approved in Canada for many different conditions, including multiple sclerosis, associated types of pain and spasticity, as well as in cancer patients with advanced level of chronic pain. And then finally we come to the herbal cannabis that we hear a lot about in the news and in the media. This is the cannabis derived from the plant itself. The thing about the herbal cannabis is that the cannabinoids and those terpenes and all those other chemicals that I was talking about can occur in very different levels, and sometimes it's difficult to control exactly what the constituents of each individual plant will actually be. So herbal cannabis is classically smoked, or it can be vaporized, it can be ingested, or there are various different oils and topical applications, so creams and oils that can be applied to the surface of the body. And so far, herbal cannabis hasn't actually been officially approved for any specific condition so far, but it is widely used to try and treat a whole host of different conditions. If you look at, this is just some data that's provided by John Page, who's in British Columbia, and he looked at about 210 different strains of different types of cannabis obtained from various different licensed producers across the country. And you can see there's this whole range. If you just focus in on the THC and the CBD, there's quite a whole range of different concentrations of even just those two chemicals within the different strains of herbal cannabis that you can purchase and be prescribed. And you can see that the majority of these strains have a lot of THC in them, but maybe not so much cannabidiol and not so much of the CBD. On average, it's around about 17.5% THC and maybe with a little bit of CBD thrown in on the side. But this is an emerging area, and we're understanding more about the botany of the plant and the different constituents associated with it. So, cannabis and chronic pain. Most people who are taking medical cannabis are smoking it, and there are various advantages to smoking cannabis. By inhaling it, the cannabis is taken rapidly into the lungs, and so there would be rapid pain relief for the patients. It's fairly easy to titrate, in as much as that maybe a patient only needs to have 2 puffs of a joint before they go to sleep, or maybe during the day if the pain is feeling particularly bad, maybe just 1 or 2 puffs is all that they require to help get rapid pain. A lot of patients talk about how smoke cannabis can have improved sleep, and their anxiety levels are dramatically can be dramatically reduced, which chronic pain patients are certainly an advantage. Of course, there are many disadvantages with smoking cannabis. It is not, of course, the safest mode of administration. It's not the way that any other drug is prescribed or it is thought about to be taken in this particular route. It's not appropriate for all patients. Maybe younger children, younger patients, smoking cannabis is maybe not appropriate. Patients who maybe have an underlying respiratory condition, obviously smoking cannabis is not going to be good for them. We're familiar with the psychotropic side effects associated with smoking cannabis, and as I just showed you earlier on, the levels of the different cannabinoids and non-cannabinoid chemicals can really vary between different strains of the plant. So there's a lot of variation. So instead of smoking, there's other ways of administering it, and the plant can be vaporized. So this is an example of an e-joint here. So the components of this, like an e-cigarette, I guess, with an e-joint. There's a heat source which is able to heat up the cannabis oils. That's placed within a chamber here. There's a filter screen to filter out any noxious hydrocarbons. There's a heat source associated with it to allow vaporization of the cannabis. There are various different control systems on the e-joint. You can vary the temperature, and that allows you to modify how much dose you're going to be inhaling. But of course, with a lot of solvents associated with a lot of these cannabis oils, such as naphthalene, butane, and ethanol, which we don't really know what the long-term effects of inhaling some of these solvents could actually be. So the other way of taking medical cannabis is through ingestion, and these could be in oil preparations and in various different butters, and can be made into brownies, which can be ingested by different patients. And I've just taken some of these images from the Aphria website, and you can see that if you inhale, if you're either vaporizing or smoking cannabis, you get a very rapid response, which then rapidly decays over the succeeding hours. Whereas if you're ingesting an oil or butter or a brownie or something, there's a very gradual increase in the amount of cannabis that's going to be ingested into the body. And so the onset of effects can be, if you're smoking, it could be around about 10 minutes, but if you're ingesting, it could take up to 6 hours before you start seeing any effects of the cannabis. And the duration, as I said, for smoking could last maybe about 30 minutes, but if you're ingesting in these butters or oils, etc., it could last up to 2 hours. So the advantage of ingesting cannabis is that it doesn't cause any respiratory irritation. The onset of effect is a lot slower than inhalation, and but the difficulty therefore is that it's not as easy to titrate or try and get the best dose for your particular needs. Okay, so now I just want to maybe finish off by talking a little bit about some work that we've been looking at. We've been interested lately in looking at cannabidiol. As I said, it's a major chemical component of cannabis. The amount of cannabidiol actually varies strain by strain. And as I mentioned, it doesn't produce any of the highs that we are commonly associated with other types of, or other chemicals found in cannabis. It can cause sleepiness, so that can be of a benefit in some patients who are having difficulty sleeping. And it really is considered a very safe type of chemical that's found within cannabis. You can ingest grams of this stuff without any major toxic effects. So how do we go about assessing pain in our laboratory setting? Well, what I'm showing you here is just a cartoon of the pain pathway. So we know there are lots of nerves in our joints and in our skin and in many different organs of our body. And some of these sensory type of nerves are very sensitive to movement or painful conditions, painful stimuli. And what happens is there are electrical signals that are transmitted along these nerves, and they enter the spinal cord, and then the spinal cord transmits that information up to the brain, and it activates particular regions of the brain, and you get that sensation of pain, and also some of the emotional components that are associated with feelings of pain. And what we can do experimentally is we can measure the electrical impulses that are coming from these sensory nerves, because we know that if these impulses increase in frequency, then that's going to be interpreted by the brain as pain. And what we've been able to do experimentally is locally administer cannabidiol into the joint and then see what effect it has on these pain electrical impulses from the pain sensing nerves. So this is just some recording I wanted to share with you that we just published very recently. And what I'm showing you here is the electrical activity from a sensory nerve that's coming from a joint in response to a painful type of movement. And you can see that there's a lot of activity associated with these nerves, and that will be interpreted by the brain as pain. Now, if we treat locally by giving CBD into the joint and give the same sort of movement, you can see the number of electrical events is dramatically reduced. So that pain signal, these number of pain impulses, is no longer given to the brain, and the brain no longer feels that type of pain. So just to say that if you locally inject CBD into the joint, we were able to reduce that pain sensing nerve activity, which was very exciting and had no side effects associated. Well, the other things is in our we look at some rats where they have arthritis, and we train our rats to sit on their hind legs. We put a little bit of peanut butter in a tube here, and the animals sit and they chew away on the peanut butter all day. And just underneath the paws are a couple of weight balances, so we can measure how much weight an animal is putting on one leg versus its other leg. And of course, if he's got arthritis in one leg, he's going to shift his weight over to the other side. And what we found, again, by giving cannabidiol locally into the joint, we were able to reduce that pain so that the animal was now balanced and distributing its weight 50-50 across both of its legs. And the final discovery that we've just made is the effect of cannabidiol on the nerves themselves. So something recently that we've discovered in osteoarthritic joints is that the nerves themselves can become damaged. Now that's very important because a lot of the drugs that we typically use to try and treat osteoarthritis pain don't address this nerve damage. And this, what's called neuropathic type pain, goes left untreated. And so what I'm showing you here are nerve fibers, and around these nerve fibers is the coating that surrounds that nerve. And in the osteoarthritis joints, these coatings are either damaged or they're very, very thin. And that can lead to abnormal firing of these nerves, and you feel this neuropathic type of pain. Now, when we treat our osteoarthritis models with cannabidiol, you can maybe see that the coating around these nerves is a lot more regular, it's thicker, and what we've managed to be able to do, just like rewrapping a broken wire, is that we were able to improve that coating, and so now that nerve doesn't fire abnormally, and you don't get that neuropathic type pain. So medical cannabis, from what I've hopefully shown you today, is looking very, very promising. We know there's good anecdotal evidence that cannabis seems to be good for some patients. We talked to different patients who are taking medical cannabis, and not all of them, but a certain number of them seem to get benefit from either reduction in pain, improvement in movement, and maybe improvement in sleep, maybe improvement in their overall mood of living with these chronic diseases. But anecdotal evidence isn't really enough. We really need scientific evidence to help support this. And we're playing catch up in some ways as scientists. But that scientific evidence is slowly and gradually building. And some of that data I've been able to show you and share with you today. As I said, medical cannabis is maybe not suitable for all patients. And I think talking to your primary care physician about this, whether it would be suitable for you, would be a very prudent way to. And finally, of course, at the end of the day, what we really need is we need more research to try and understand some of the benefits and maybe some of the potential hazards associated with taking medical cannabis. So finally, I just want to acknowledge the Arthritis Society, who fund who funded this work. I need to acknowledge the people in the lab who do the day-to-day work. Particularly, I wanted to thank Holly and Melissa. Melissa received a studentship from the Arthritis Society to help do this work. Also Len Mooney, who has now got his doctorate. He was also funded by the Arthritis Society, and now has gone on to greater and better things at the U of T. And I'm thanking you for your attention.
Thanks very much, Dr. McDougall. That's a terrific overview. So it's one thing to hear about the science behind medical cannabis and how it works. It's another thing to understand how it plays a role in managing chronic disease. And to help us walk through that process, I'm pleased to welcome Dr. Christopher Blue.
Thank you. Can you hear me, I guess? Yes. Okay. I'm just looking out the audience, and I made a comment earlier of just the demographics of the audience. I mean, if we think back 10 years ago, if we were having a conversation about cannabis, the demographics probably wouldn't be what we have here today. And that was my concern as a physician when I first started prescribing cannabis was, what kind of patients am I going to get? And this is reflective of exactly the patients I see when I look out over the audiences from a demographic standpoint. Just like most of you sitting here thinking you'd never be at a sort of a town hall meeting to discuss cannabis, never in 1,000 years did I think I would ever be prescribing it. And lo and behold, here we are. In a medical standpoint, I mean, cannabis has been actually documented in history, used as medicine for over 6,000 years. It was well known, documented in medicine, and up until about the early 20s, the 1920s, and then eventually the prohibition of it happened, and then you just you had it was dismissed pretty much off the face of the earth as a reasonable form of treatment, and then now you sort of have the genesis of the addition of cannabis back into medicine, and it's full of a lot of healthy skepticism, because everybody from a medical standpoint, a lot of physicians or healthcare providers are hesitant because unfortunately we're to a point forced to practice in fear, and given what has happened, especially with the opioid crisis, we always are practicing in fear. As Dr. McDougall said, cannabis is not something that is taught in medicine. It's not something that's taught in medical school. I'm younger. I graduated medical school in 2004. I've been, a physician now for 13, 14 years. It wasn't something that I was ever taught. I never heard of anything about it in pharmacology or physiology classes. And he hit a good point on what's called the endocannabinoid system. Whether we like it or not, we're all sitting in this room, and we all are actually creating our own forms of cannabinoids or cannabis called anandamide. And that if we were to actually be able to have a blood test and measure that, which is not available, there are certain diseases where you would be deficient in your own body's cannabinoids, natural cannabinoids, and diseases like multiple sclerosis, chronic pain, cancer, Parkinson's. I mean, the list goes on and on and on, where you are deficient in your own natural body's cannabinoids. This is no different than if you're deficient in serotonin and you suffer from depression, or you're deficient in insulin and you suffer from diabetes. In fact, the endocannabinoid system was only really discovered in the early 90s. So in the sort of the evolution of medicine, we're still at the very beginning of understanding this. But yes, unfortunately, it is not something that is taught, and a majority of physicians don't know about it. And what they do know is their own sort of, just like I have had, and I'm sure most of you in this room had, your own sort of preconceived notions of what you were taught and how you were raised and what you were supposed to believe. We're now sort of debunking all of that, and that has been a difficult pill to swallow for most, to say, well, sorry, my parents were wrong and we were wrong, and actually this can be good and can be beneficial. In clinical settings, what I see for the most part that I'm seeing patients that get referred to me for medical cannabis is a multitude of diseases, chronic pain, cancer, muscular dystrophies, multiple sclerosis, seizure disorders, you name it, I have seen it. And that's what's very fascinating about this plant is it is, in my opinion, one of the most complex medications that we have on the face of the planet, and we're just now starting to understand it. The complexity of the plant, of all the cannabinoids that are out there, is groundbreaking once we start understanding it. And we do need to start having more and more research so we can understand it even more and be able to provide better access as well as better forms of cannabis. Currently, the journey that a patient goes through to access cannabis is either they talk to their physician, and if the physician is comfortable prescribing it, that physician will register the patient with what's called a licensed producer. And in Canada, really the only legal access to cannabis is through a licensed producer. And unfortunately, there is a lot of misinformation that's out there. A lot of patients that were told something, or they heard something, or they read something, or they went to a dispensary and were told something else. And that's unfortunate, because we also have to deal with something that, if you're doing it incorrectly, is illegal. And nobody wants to knowingly break the law. And so I see a lot of patients that have unfortunately been preyed upon, where they've received misinformation or illegal forms of cannabis and not even knowing it, with no intention whatsoever. So I think education about what is legal, what is safe, what is correct, certainly from a medical standpoint, needs to be put in the forefront. Also, cost of it. I'm not originally from Canada, I'm from Florida, and one thing that I've learned once I've moved to Canada and started practicing medicine here is Canadians aren't used to paying for their medications, and so this has been a very interesting, not debate, but a dialogue that I constantly have with my patients. Is yes, you have to pay out of pocket for it, and it is not cheap, or it cannot be, or it can be expensive. I think it's unfortunate that a lot of insurance companies and government subsidized programs will cover certain medications that, let's face it, we're in an epidemic with, that are covered under all benefits packages and disability packages and government subsidized packages, and people are dying left and right. But yet access to cannabis isn't covered, and it's safe, and there is no lethal dose to it, and we have to pay for it. So why is one okay and the other is not? Moreover, why do we charge a tax on it? It's the only medication that's taxed, and so I hear these complaints all the time, and my advice always is, as I'm only one person, I can only do so much, but it is time to sort of speak up. And me personally, I have met with my local MP to discuss these concerns, because in my opinion, this is a way to help mitigate the crisis that we have with overdose and with prescription medications. That's about it. Yeah.
Perfect. We are running a little long, but we want to make sure everybody gets an opportunity to hear what our speakers have to say. So thank you very much, Dr. Blue. So having heard about it from the perspective of the medical practitioner, now would be a good time to hear about it from the perspective of a patient, someone living with chronic disease who's turned to medical cannabis as part of their treatment plan. So I'm pleased to welcome Lauren Meadows.
Okay, hopefully y'all can hear me. Okay, thank you. I was diagnosed with rheumatoid arthritis as a late teen. There was an assumption that I did have juvenile rheumatoid arthritis as a young child. However, I sort of slipped through the cracks. I had a lot of unexplained fevers, joint pain, sometimes the inability to walk. It would feel as though I had sprained a wrist with no explanation. X-rays and lab work always came back clear. It wasn't until I was in my first year of nursing school that, and during a practicum week, that I was unable to assist my patients. I had trouble with dexterity. I had trouble with lifting, transferring patients, gripping things, flipping lids off vials, things like that. And finally, my professor said, hold on, we gotta figure out what's going on with you. So I took a year off. In that year, or 18 months, I was finally diagnosed. I saw multiple doctors, including a rheumatologist who didn't diagnose me. It wasn't until I saw an orthopedic surgeon that she took one look at the joint damage that had already occurred in my wrist and said, you have rheumatoid arthritis, I'll send you to another rheumatologist. So after that, because when you have something like RA, you usually have multiple diagnoses. I was also diagnosed with osteoarthritis and eventually fibromyalgia and some other autoimmune disease. So it did take a while for me to be diagnosed, and unfortunately in that time, I sustained a lot of joint damage, particularly to my wrists. It's hard for me to move my wrists in any direction. So a lot of my symptoms, along with not being able, like loss of movement, I also have issues with dexterity. Sometimes a bed sheet can feel like it's 1,000 pounds in the middle of the night. But if you see me during the day, I'm usually pretty spry and I can do a lot of things for the most part. It usually takes me a lot to get there at that point. So I've lived a long time with, being told you don't look sick. I first was introduced to medical cannabis through the Arthritis Society. I had done, I was very familiar with the Arthritis Society. I'd volunteered. I have done their walks for many years. I've always used them as a resource. They were the first people to help me through occupational therapy and physiotherapy when I was first diagnosed. So I was having a really hard time, particularly with pain management. And not only that, but insomnia and fatigue. And if you're a chronic pain patient, you might know that some of the medications you're prescribed don't tend to help with those areas of your pain. So I needed something that wasn't only going to help with pain, but also with the swelling, because the swelling causes pain, and also with fatigue and insomnia. So because I had been on every medication under the sun from the age of 18 onwards, I was sort of fed up with side effects and the ineffectiveness of the medication I was being prescribed, and just feeling that if I needed something at that point, did I really want to take it? Because if I took it, I was going to have all these side effects. So was it really worth me taking this? Which led me to going to the Arthritis Society website, and I found a really nice video done by my friend, Rachel, she now works for Aphria. It was the first time I had actually met someone my age with arthritis and that was using the medical cannabis. So I actually got in touch with her on a personal basis to find more out about it. And once I did, then I approached my family doctor about possibly using medical cannabis and what it could do for me, all the while being quite skeptical because I hadn't used recreational marijuana in the past, and I didn't know, and any time I had experience with it back in my college days, I hadn't pleasant experiences with it. So I was very skeptical when I went to my doctor, and I thought, I don't know if this is going to help me, and if it will help me, is it going to make me feel awful? Am I going to be able to function not only as a mother and a wife and a small farm, hobby farm owner, but also at my job. So my doctor, actually, I was very lucky. My doctor was very on board with it, and he referred me to a cannabis clinic here in Windsor. And that's how I was put through the whole process. And I saw counselors as well as doctors via telemedicine at the clinic, and they were able to help me to find strains that would particularly work for me. I do need to take something with no THC during the day, obviously. I need to drive, I need to work, I need to have a home life and be able to function. So that was the first thing I found, was that I was able to have a pain control method that didn't impair me in any way, shape, or form. And then I also was given strains that help me to sleep at night. It's a huge thing for me to be able to have a full night's rest. I usually go to bed pretty early, so I need to be able to get a good night's sleep, refresh myself, and carry on the next day. I don't know what else I want to say about it. That's about it.
Thank you very much, Lauren. We'll come back and have an opportunity to explore that in a little more detail in a moment. Next up, I'd like to welcome Fabio Costante, who's going to talk about something that Lauren just touched on, which is how is this going to impact me in the workplace? What do I need to know as an employee? What should my employer know in terms of how to accommodate me? So please welcome Fabio.
Thank you. I guess I'll start with a bit of a primer. Medical cannabis has been legal for approximately 17 years in Canada. Recreational use of cannabis will be legal this year. In the coming months, the government's going to introduce approximately 17 years. And recreational use will be legal this year. I want to draw the distinction right from the beginning of recreational use versus medical cannabis in the context of employment. Recreational use, much like any drug or alcohol, could be prohibited by your employer while on the job. That could lead to discipline up to and including termination. Medical use of cannabis is different. Just like any other medically prescribed medicine, could be used, and in fact, if you're dependent on the medicine to treat an ailment, whether it be rheumatoid arthritis or anything that's prescribed, you'd be deemed under the Ontario Human Rights Code as having what's called a disability under the code, and your rights would be protected. And so it's important that we draw that distinction from the beginning. The guiding theme in employment law is finding a balance. Are there any employers here, by show of hands, that employ people? Okay, a few. And then employees, anyone currently working, by a show of hands? Okay, so the majority. So the balance really is between providing a health and safety workplace, which is a prerogative of an employer, of course, but also respecting and not infringing on individual human rights and ensuring that individuals are accommodated. And there's a whole body of law that speaks to accommodation. So the scenario is you disclose to your employer that you're consuming medical cannabis. And the employer then, there's a duty that the employer has by law to accommodate you. And that disclosure to the employer triggers that duty. And so you look at ways in which you can perform the essential duties of your job, perhaps in a different way, depending on a variety of factors. One of them include how frequent do you consume the drug? What job are you in? Are you an administrative clerk, or are you in what's deemed a safety-sensitive position, which could be maybe a school bus driver or someone who's operating heavy equipment? And it's a two-way street when you're discussing accommodation. The key is open and honest communication with your employer and vice versa, and ensuring that the consumption of medical cannabis doesn't get in the way of the workplace, and that you're accommodated appropriately. So what I say to clients who are employees who ask, should I tell my employer that I have a prescription and that I'm using this, I say yes. And I say that because an employer cannot discriminate against you in the workplace. And if they do, whether it be termination or treating you differently as a result of taking medical cannabis, you have rights under the Ontario Human Rights Code. You could advance a claim, okay, that could see yourself successful, whether it be monetary damages for injury to dignity, self-respect, and feelings, including lost wages if they terminate you, and, get this, the power to be reinstated in the workplace for non-unionized employees. The code allows that. So don't be afraid to disclose to your employer, especially if it's inhibiting your work. They can't terminate you as a result. We've only got a few minutes to give a spiel here, but these are the broad themes that I'd be happy to discuss. There's been some recent Supreme Court of Canada decisions that speak to employers imposing policies to not necessarily circumvent human rights laws, but to try to control the workplace for those who are either dependent on drugs or addicted to them. I'd be happy to talk about that in greater detail, but I think my time is probably up, so thank you.
Thanks very much, Fabio, and it is good to hear that this is a conversation that people should feel free to have with their employer, which brings us to my employer. Our next speaker is President and CEO of the Arthritis Society, here to talk about our involvement in this space and probably touch a little on that work piece as well. So please welcome Janet Yale.
Hi, everybody. Good evening. I want to thank Aphria for sponsoring this event. I want to congratulate my fellow panelists for really articulating some of the key issues, and thank all of you for coming this evening to a session on something that at the Arthritis Society we think is very important. And you may be asking yourselves, I hope you're asking yourselves, why does the Arthritis Society care about medical cannabis, and why are we involved in this issue? Because it's kind of unusual for a health charity to be leading a charge on this particular treatment. And it's because when Health Canada used to have to authorize you individually if you wanted to use medical cannabis, the data indicated that over half the people who had personal authorizations for medical cannabis were using it to alleviate arthritis pain. And yet, they were having a terrible time getting access to the treatment because it was so hard, and still can be quite hard, to get a prescription, what's technically called an authorization. And we know that for many people living with RA or OA, osteo or rheumatoid arthritis, pain is something that is really a preoccupation. And for many, their healthcare provider doesn't really think about pain alleviation as much as they think about the symptoms of the disease itself. So we felt it was incumbent on us to, on behalf of the patient community, take this issue seriously and to do something about it. So as this gathering shows, there's a huge amount of interest, and we're really delighted to be leading the way on how to improve access and affordability for medical cannabis. I'm going to tell you very, very quickly at a high level what we've been doing, and would welcome your questions. First of all, as you heard from Dr. McDougall, we need a lot more research. We have very good anecdotal evidence about how medical cannabis works. We don't have enough research in three areas: basic research, the kind of work that Dr. McDougall is using to understand why, when your joint has damage, you feel pain in your brain. How does that system work, and therefore how do we get more effective treatments? Secondly, we need a lot more clinical studies, so for each kind of disease we know much more about exactly what form of cannabis and what dosage to be prescribed to you. And we need more health policy research to understand safety issues, driving issues, and the like. So we've asked the federal government in the next federal budget to put $25 million into medical cannabis research. And we're hoping that we hear good news in the next federal budget on that. 25 million. Secondly, that's a drop in the bucket in terms of what we need, but it's a good start. And to reinforce that, we've already funded 2 researchers in medical cannabis, Dr. McDougall, who's doing basic research, and Dr. Mark Ware, who is doing a clinical study on cannabis for arthritis patients. Secondly, we know people need a lot more information. So we've built a whole section of our website called arthritis.ca/medical cannabis, where you can find out how to ask your healthcare provider for an authorization, what an authorization looks like. We have other kinds of information, tools, and resources there, what questions to ask your healthcare provider and the like. Third is advocacy. We've been working very hard. When the federal government announced it was going to legalize recreational marijuana, many partners in the medical community wanted to see the elimination of the medical cannabis regime, including the Canadian Medical Association, because many doctors were not comfortable prescribing it. So we joined forces with a number of other advocacy groups to try and preserve the medical cannabis as medicine in a post-legalization environment for recreational marijuana. And I would tell you that we were not winning that fight in the formal consultation process. So what we did was we asked the task force to hold a special consultation just with patients. And so all of us brought together 24 patients with conditions ranging from arthritis to post-chemo nausea to MS to Parkinson's, you name it, HIV/AIDS patients, they were there. And for 3 hours, they told their stories to the task force, like we heard tonight, about how medical cannabis changed their lives. And we were so pleased that the task force, in its recommendations to the federal government, said you have to keep the medical cannabis regime intact, and they've committed to do that. So July 1st, when recreational cannabis marijuana is legalized, it will not do away with the medical cannabis regime, and we worked very hard to ensure that. But there's more to be done, including, as you mentioned, taxation. So we're working hard to get the government to see that there should not be tax on medicine, the HST that currently applies, and post-July 1, there will be an additional tax in the form of an excise tax, $1 a gram or 10%, whichever is higher. So we're working hard to prevent the addition of more taxes when marijuana is legalized. And then finally, there's the affordability question. As you heard already, most insurance plans, so if you have medical benefits covered as an employee, many plans, most plans do not cover medical cannabis, so people have to pay out of pocket. And in Canada, we don't think we should have to, for sure. We have been trying to convince insurers and employers to cover it, and we've decided to lead the way. So as of February 1st, tomorrow, all of the employees at the Arthritis Society will have medical benefits coverage for their medical cannabis. And thank you. Very excited about that. And we're doing it in a way that all of the policies, procedures, templates, forms will be publicly available, so any employer or insurer who would like to figure out how to do it will have an easy sort of plan in a box for them to use. So we're really hoping that this will start to change the conversation about insurance coverage, and feel free after tomorrow to tell your employers that it is very easy and possible to do. Thank you. Look forward to your questions.
Thank you very much, Janet, and thank you to all of our speakers. In the interest of time, we'd like to get straight to your questions. So if you do have a question that you'd like to ask publicly, I'd ask you to approach the microphone, and we'll take you one by one. We'll also go to a couple of questions from our Facebook Live audience, and if there are any questions that were submitted in writing, not yet. If you do have a question that you'd like to ask but aren't comfortable getting up in front of the microphone, just fill it out on a slip of paper and either set it in the box at the back or hand it to one of our volunteers in the snazzy blue t-shirts, and they'll make sure I get it up here. So is there anyone who'd like to kick things off? I see a couple of volunteers.
I'm not sure who's going to answer this, but you said that the cannabis products are dispensed through the cannabis producers. Will eventually it be going through a prescription instead of going through the producers? Will it go through a drug supplier like Shoppers or Rexall?
I can kick that off. We've certainly made a recommendation to the federal government and to all the provincial governments that pharmacy distribution should be permitted, just like with other prescription drugs. That is not yet legal. So right now, as you say, the only way to get it legally is through mail order. But we are hoping that within the next year it'll also be available through pharmacy distribution. A number of pharmacy chains have made it clear they would like to be able to do it. They're ready, willing, and able, but they need legal authorization from the government.
Okay, thank you.
Hello. Both my husband has arthritis and diabetic neuropathy. He's presently on Lyrica, and for pain, the doctor has prescribed tramadol and also Percocet, which he refuses to take for pain. Is medical marijuana available for diabetic neuropathy besides arthritis?
Dr. Blue?
Yeah, certainly. I mean, I don't see why not. I mean, let's face it, I don't have people that I've prescribed Lyrica to come back and say, thank you very much, that helped me so much. Whereas patients that find the correct strain for cannabis, they are very grateful and it can work very well. So yes, definitely, that is an indication for it.
And quickly, are you able to just make an appointment with you without going through a referral for the doctor? Because he has asked for a referral to a cannabis clinic and he has not been given that referral.
Me personally, no. From my practice standpoint, it's on a referral basis. And yes, you do have physicians in the community that will say, nope, I don't want anything to do with it. That stuff is the devil, and don't ask me again. Here's your Percocet.
Okay, great.
Yeah.
Thank you.
Sorry, ma'am. I was going to say, though, there are cannabis-specific clinics that your husband could approach where they can see a doctor via telemedicine or in the clinic who would review his particular case and consider prescribing cannabis if it fits the bill. So, yeah, it's not an end game. If you have a physician, say, family physician that says no, there are still other ways to access it that way.
Okay, great. Thank you.
Hi, my name is Kathy Rogers, and I just want to add to your presentation tonight. I have arthritis as a result of Crohn's. I have been in remission from Crohn's for 10 months after Remicade and all the other heavy drugs failed, and TVO, via cannabis. And with the arthritis, not long ago, I couldn't walk very much without a walker. And I walked an hour and a half while I was in Florida on vacation since I've been on the cannabis. So I just wanted to add to that. Thank you.
Hi, I'm a medical user. I have two questions. When I keep asking our medical provider, when they will consent to paying for the prescription, they said they can't do anything until it has an RX number. Is that in the foreseeable future? The other thing is when I go and get my script renewed, you talk about finding a strain that is suitable for you. Twice I've gone now, and I've had to do my own research, and it's very difficult because a lot of the suppliers or producers, you have to forego your script to them. So it's difficult when you sign up and you're looking for 24 CBD, and then you're told they don't carry it anymore. Well, now you have to take 12 or 18, but I can't transfer my prescription. So with it becoming legal in the future, do you see any changes in that? And again, when will we get an RX number so, we could have coverage for it?
One way to get coverage is if there are RX or DIN numbers, because then everybody will have to agree it's medicine. That doesn't mean it's not medicine today. So the reason we've created a way to provide coverage without those numbers is what I was talking about earlier. You don't actually need those to provide coverage. You just need a willingness to expand coverage to include medical cannabis. The advantage of an RX number is it says for this disease you have this many pills of this kind, right? So it makes it easy to know how much coverage to provide, right? There are other ways to get there with insurance plans, and I think the work we're doing and that we're going to be talking about publicly over the next month will start to help insurers understand how to do it without those numbers. It's not that hard to do.
And if I may just quickly ask one more thing, the Canadian Disability Tax Credit, can you
Yes.
say much on that? Because unless, and I've been told, unless you're in a walker or a wheelchair, you do not qualify. And I was turned down twice. So I just want to know if there's going to be any changes in that as well.
But I want to address the thing you said about the prescription. One of the changes that the federal government is proposing in the regulations is to allow you to split your authorization among multiple LPs so that you won't have to worry about the situation you've described. And it's one of the, I was at a consultation on the new federal regulations, and they are going to specifically address your point, so that if you need multiple strains, only some of which are available through any individual LP,
Correct.
you'll be able to manage that with the regulations that are going to come out in the next little while.
Okay, thank you.
Expand on that?
To kind of add to that, the whole the DIN number, the RX number, I don't know why it's that seems to be an excuse to delay things, in my opinion. I prescribe a lot of compounded medications where they have to be made from a compounding pharmacy, the old school mortar pestle to make something. And you could actually have your compounded medications, they don't have a DIN number. The compounding pharmacy can assign a pseudo DIN number to it, and then your benefits package will cover it. So there is ways around it, such as that, and I don't know why they don't look into other options. It can be, in my opinion, an excuse. As far as access, you're absolutely correct. Yes, the demand is far greater than the supply. And the licensed producers run on shortages because they can only produce so much, and they're regulated with their square footage and how many plants that they can have. I have no control over that. I'm just the doctor. So there is shortages because the demand is far greater than the supply. The splitting of the prescriptions, absolutely. I know the different strains that are out there and the thousands of different ones that are out there, but in the ministry's eyes, it's a controlled substance. It's no different than a Percocet or an OxyContin. You can't split your OxyContin prescription. You can't get your 10 pills from this pharmacy and 20 from that pharmacy. Even though cannabis is completely different, they're looked at all kind of one and the same, and that's unfortunate. I don't agree with it, but I have to follow the rules. Yeah.
Okay, thank you.
So, just a quick update. I'm recognizing there's folks with mobility restrictions. If you have a question and getting up to the microphone is a little inconvenient for you, raise your hand and we can bring the mic to you. Before we continue in the room, I'll just ask one quick question from our anonymous questions, which is, what's the best advice in responding to crossing the border questioning? And one could expand that as well to roadside stops and similar.
Wow, I don't want to give a legal answer to this.
Right.
Lawyer?
It's not. I told client, son, it's not mine. That's number one. Number two is I didn't know about it. Because one element of proving drugs possession is knowledge and control, right? But I don't practice criminal law. Okay, so I've got to say that outright because it's not an area of expertise for me. What I can say though is the office that I work at, we prosecute all of the drug offenses in Windsor, Essex County. And less and less, because recreational cannabis is still used as, or still deemed illegal pursuant to the Controlled Drugs and Substances Act. But less and less am I seeing, and this is anecdotal, police officers laying charges on people that are consuming cannabis, whether they have a prescription or not, right? The issue nowadays, the epidemic nowadays are the opioids, crystal methamphetamine, crack cocaine. This is the stuff that's killing people. This is the stuff that police deem to be an epidemic. If you don't have a prescription to the drug, there's still a possibility you could be charged up until the regulations get passed in the next few months. So, although I initially joked that you could say those things, police still have a foundation to charge you.
Doctor?
To be honest, I think the question was if you have medical cannabis and you go across the border.
So,
Right?
Yeah.
so in my office, when I see a new patient, I clearly state to them, you are not to leave the country with this, period. It does not cross an international border, period. And in my sort of disclaimer that, you know, I have them all sign everything, it is in there as well, and it's initialed by that. And you know, it never fails. I'll always get somebody that wants to dialogue about it. And I even say, even if you're flying from Toronto into Denver, Colorado, which is essentially ground zero, it is still, the American standard is federally illegal. That is a federal border you cross, that's federal airspace you enter into, and those are federal customs and immigration agents that will stop you in Colorado and charge you federally. So don't do it. And I leave it at that.
And I think that addressed our asker's follow-up question as well, so thank you very much. You've been very patient. Go to you now. Thank you.
Good evening. I have been informed that Sun Life Company does cover the cost of marijuana. Do you know of any other companies that do the same?
What I'm aware of, there are a number of insurers, they would be doing it on behalf of employers that they're interested in. Most of the ones that cover it today, for those of you who understand the difference in different parts of your benefits plan, is they don't cover it as medicine. They cover it under what's called a health spending account. I don't know, does anyone here have a health spending account? So you may have your medicines covered under your drug plan, and then you'll have a discretionary amount of money that's called a health spending account. It may be called different things under different plans, where you can expense a gym membership, you can expense your chiropractor, your physiotherapist, that sort of stuff. And most of the insurers that are covering it today are allowing you under your health spending, your discretionary health spending, to allow you to get medical cannabis. Our view on that is that's not treating it as medicine. If it's medicine, it should be under the drug plan, not under the health spending account. So it may be there, but I don't think it's, but it's coming. It's coming.
Will it come by July 1st? Is that what?
I think it's a question of you as employees asking your employer to look at getting it covered. It's going to be pressure from people like it is with the doctors starting to authorize it that's going to change. They're going to change the game. And if they give you the excuse there's no DIN, you can say, well, the Arthritis Society figured it out. Look at their website.
Great. Thank you so much.
Thank you. Thank you for giving a chance to ask a question tonight from all of you distinguished panelists. It's highly gratifying to be able to stand here and ask this question. I'd like to first touch on the disease called autism. My wife and I, we have our youngest angel, which I call Noah, 20-year-old, still nonverbal, still in diapers. And although his symptoms have improved lately, I'm very, very hopeful he's on the right track. We're hopeful from God's help and any other help we can get along the way. My question is, can you please expand on the possibility that this miraculous resin, cannabis oil and its derivatives, have what effect on autism spectrum disorders? How potentially it could help that particular condition? And whether my hopes are as well as I think are promising ahead. Secondly, my second question would be, could you please talk about the Portuguese experiment going on right now and how this might apply or transfer to this great country called Canada in return to finally show evidence-based, real evidence to the public that this natural compound is very effective, very good for you with very minimum side effects, barring your understanding about the negative consequences, and I got that to heart and I understand it. But please, say if this is a good fit for Canada to start with, to emulate Portugal and finally gain acceptance throughout the public once for all. Thank you again. I appreciate your response.
So much for your question. And Dr. McDougall, I'm not sure if you heard all that on your end, but it was asking, first of all, whether there's any indication or any perceived potential for this as a treatment for autism spectrum disorders. And secondly, what needs to be done in order to adopt or reflect advances in research from outside of Canada in what we're accepting as scientific evidence for Canadian policy decisions.
So yes, there is. Can you hear me okay?
Yes.
Yeah, good. So yes, there are some good studies out there that are indicating that certain types of chemicals within cannabis are effective for some of these autism spectrum disorders, particularly ones that seem to be higher in the CBD once again. So there are some studies going on in Australia that I'm aware of, where again it seems to be showing great promise for treating these very, very complicated types of disorders. What do we require further? Well, I mean,
he can't hear you.
Research again, doesn't it? We need to know which particular components within the plant could be beneficial for these as well as other types of chronic diseases. And that's going to take time. It's a difficult, but with the autism spectrum disorders, they're very difficult to study in the laboratory. But there should be opportunities for more clinical types of studies to address this particular question.
Thanks very much, Dr. McDougall. I know you had a follow-up, but I know Dr. Blue wanted to speak to this too. And then given the folks we've got in the line and the questions that have been handed in as well, we'll probably say that we'll do it for questions because we do want to respect the time limits. So Dr. Blue, quickly.
It's very interesting because in the clinical practice, we're limited. Under the College of Physicians and Surgeons of Ontario, the people that give physicians their license that allow us to prescribe medications, actually the guidelines recommend to not prescribe to anybody under the age of 25. And so as a physician, if I prescribe under somebody under 25, I can at risk for, well, quite frankly, losing my license. And I like having a medical license. And so have I prescribed it? Yes, I have in certain circumstances, and which is very contradictory to, we have this recreational thing coming out in July where the legal age is 18. So I can't prescribe it as a physician at 20 for a patient under 25, but you can go buy it for fun at 18. That doesn't make sense. In regards to treatment and what the outcomes that we're getting, I have had some pretty miraculous outcomes, absolutely. We need to understand more, we need to do more research on it, but it doesn't work. Also, I've had patients and families where it did nothing, and then we're left going, I don't know, and that's also very disheartening as well.
At least you tried, and there are no known negative side effects to be concerned about, right?
Absolutely.
Thank you.
Thank you.
Thank you very much.
Thank you very much.
Thank you.
Hi, I just have a quick question, and I apologize, I came in a little late. So when I came in, there was a slide up in regards to different components of marijuana affecting parts of the immune system. So for those of us on immune-inhibiting drugs, is it a concern or at all that something like medical cannabis could trigger our immune system in a negative way to throw us in a type of flare?
It's all the research that I have read is actually cannabis actually stimulates your immune system and actually boosts your immune system. There's actually been studies where they've looked at people that have had transplants, and we put them on immunosuppressants to prevent graft versus host disease. And then when they go on cannabis, those doses of immunosuppressants are actually decreased and can be decreased. So you do see positive side effects. That's all I know from from a research standpoint.
Dr. McDougall, you wanted to add in?
I actually agree with that, and also a lot of the cannabis compounds can be anti-inflammatory. So we found in our lab, and other people have done experiments where you can actually see that the cannabinoids can be anti-inflammatory, and in some instances can actually reverse some of the, if we're speaking about arthritis, can actually reverse some of the detrimental effects occurring within the bone and within other parts of the joint. So it is certainly able to boost the immune system as well as have anti-inflammatory properties.
Thanks very much.
Hi, I have actually a statement and then a question. I came in here tonight and I was very excited to see that the Arthritis Society was sponsoring this event. And I was completely overwhelmed to see how many people locally are suffering from the disease and then reaching out to find information. So the statement I have, I guess, because we have you here from Ottawa, is that we have no local chapter for people suffering with arthritis in this area. So we don't have anybody that we can speak to, like, how is this working for you? How is that working for you? So it's very difficult to get information, and you get a 10-minute appointment with your rheumatologist once every 6 months. And, as a patient that's gone through Humira, Brenzies, Enbrel, looking at Xeljanz, still not finding a perfect fit, I finally had an internist refer me to getting cannabis and actually suggesting maybe that would help. I have a prescription. I have not filled the prescription because fear. I don't know what to get. I don't know who to turn to get that information. So I'm asking if there's a possibility at all that the Arthritis Society would sponsor a local chapter here in Windsor so that these people can speak to one another, we can learn from one another. I can say to them, if you're using cannabis, what are you using to help? What are you using? Have you been through 5 biologics and they're not helping you? I'm sorry, I'm very emotional, but I'm a recent diagnosis with still 0 ability to control the disease. And like you, I go to work and everyone thinks that I'm fine and I don't sleep and that sheet weighs 100 pounds. And so is that a possibility? Is that within the realm?
Well, first of all, thank you for sharing your story. I know how hard that is and how emotional it can be. We would love to have offices in every city. Obviously, that's not necessarily something we can afford to do, but what we do want is to create communities everywhere of like-minded people, and what we need is volunteers to help us organize that. So if there's a group of volunteers that would like to come together and help us bring the arthritis community together and provide that support to each other, please. Who should
I reach out to?
All right.
I'd be more than happy to.
We have people here who are part of the arthritis community, and they're ready, willing, and able to take your information and make sure you get the support you need. Thank you.
Thank you.
Dr. Blue, I wondered if you could speak to the benefits and risks of cannabis taken alongside of medications used for epilepsy.
Yeah, so very controversial. If you actually look at drug-drug interaction with cannabis, it's doesn't really happen. There's a handful of medication that where, for instance, a seizure medication, clozapam, can prolong the effects of THC a little bit. But as far as increasing lethal doses of, toxicities of medications, actually cannabis is safe. That's why a lot of times when I start patients on it, I tell them from day one, I want you to continue taking your other medications to start with. Do not stop them, because there is going to be a trial and error period of trying to figure out what works best for you. Once we're getting good results, that's when we start pulling back those other medications. So drug-drug interaction is something we always are concerned about when prescribing pharmaceuticals. But in my understanding of how the cannabis and the cannabinoids work on the endocannabinoid system, it has its own receptor system. There isn't competing cannabinoids for that receptor, and so there is not really any drug-drug interaction there.
Okay.
Does that help?
Yeah.
Dr. McDougall?
Yes, sorry, thanks. One of the potential positive drug-to-drug interactions is actually with the opioids.
Mm-hmm. He's right.
There's really good evidence out there to show that cannabinoids and opioids can actually work together.
Synergistic.
So if you get this level of pain relief with your cannabis and this level with your opioid, you put them together, it is actually much bigger than the parts. And that's very important because that gives us an opportunity to perhaps reduce the amount of opioids a person is taking, which we all know would be a great benefit for chronic pain patients. So there are some positive drug-to-drug interactions, but we need more research to look at some of the other drug-to-drug interactions that there could possibly be.
Thank you.
That's related to the Portuguese model and whether we can learn from the way they're using it in Portugal.
I'm not familiar with that one.
Yeah. We'd have to look into that in more detail. Thanks very much.
Dr. McDougall, I find it fascinating to see that they've been doing some studies to show that by injecting the CBD into some joints with osteoarthritis, that you have, it shows a repair of joint damage. My question is, in your studies so far, the repair, is it permanent? Is it temporary? Does it require to give more injections at regular intervals in your study?
Did you hear that?
Yeah, thank you very much. That's a great question. We're very excited about the opportunity to be able to control pain and inflammation and some of the degenerative changes that occur in arthritis directly within the joint itself, as we were the first to show that there are actually those cannabinoid receptors within the joint, and that by locally giving those cannabinoids we can control the disease. I would have to say that, how long that protection lasts for, we're still investigating that. But with respect to rheumatoid arthritis, we know that some of the cannabinoids can reverse the degeneration that's occurred within the joint. But these are still very early studies, and we need to find out how long exactly those things last. But it's really promising and very exciting.
Okay, thank you.
Thank you.
I have another question.
If you can make it quick.
Quickly. It's regarding going to the States with your medication, medical marijuana. I don't know if this is something that is okay or not, but I talked to the UPS. When you know where you want to go, and you're going to stay for a while, you have an address where you're going. For example, in California, I was told that through the UPS, as long as I declare what I have to bring, what I want to send, what I want to send by mail, and I prove that it is medical marijuana. I tell them what it is. I give them my passport to prove that I'm a Canadian receiving medical marijuana. They apparently they can do it and they can send it, and there is no problem with the customs regarding that. That's what I've been told, but I have not tried it.
I imagine
Just
that
about
would
it.
vary depending on where you go, but unfortunately none of us are that kind of lawyer. So I would suggest approaching that with caution.
With caution. Thank you.
Hello. About once 37 years ago, and the second time 35 years ago, I had a headache that was so bad that just moving the hair on my eyebrow, I was in torture, and over-the-counter medicine, or prescription medicine, nothing helped. I just happened to have someone give me a marijuana plant in my living room. So at both times, I just took a couple leaves, made some tea, and within 2 minutes, I was okay. Now, today, I have a friend who has a similar problem, and I was thinking of going to the doctor and saying, like in those days, it wasn't possible, but nowadays, go to the doctor and say, can this person get a prescription for some marijuana, just a little bit for that type of headache? But at the meeting today, I saw that you had broken down into different aspects of THC, this and that, and some other initials that I didn't memorize. So now I'm afraid to go to the doctor. Like, it doesn't sound as simple as, is there anyone that can give me a prescription, or this person a prescription for a little bit of marijuana? It sounds like you have to know, like, study the different, like, would the doctor be able to say, yes, I'll give you some, or she's not going to understand, like, you have to break it down into different types of marijuana?
I mean, I can't answer what a doctor does or doesn't know, or what they'll be able to give you advice on. I don't know the knowledge of every single physician's prescribing.
It's not that simple then.
No, it is. It's not as simple. I mean, the term cannabis is such a broad term of all the different types. I mean, there's thousands and thousands of different strains, and thousands of different concentrations, and thousands of different cannabinoids and how they interact with each other. That's why it is the most complex pharmaceutical medication that we have available, period.
So I have to wait till it's legal, and this, like, I don't know what they call it. In high school, they call it nickel bags, dime bags, just.
Yeah, I mean, but that's, again, you're referencing the recreational side of things, which I don't really have a comment on.
It sounds like the question is in part, if you're not sure what to do, and you don't even know how to raise the question to your doctor, how do you proceed?
If you're unsure what to do and your doctor's unsure what to do, have them send you to somebody who knows what to do. I mean, there are physicians available. There's clinics that you can go to that, you know, there are physicians that understand some cannabinoids and can give you at least some guidance and some advice.
So the Arthritis Society, on their webpage, do they have, like, you click on a link to clinics in your area or something like that?
We don't currently have a list of who in each community is able to, who's knowledgeable about this, but certainly if you reach out to the Arthritis Society, we can help find you that information.
Yeah, thank you.
You're welcome.
And I apologize, we're actually a little over time at this point. I know we had a couple of questions more at the mic, and I had a few questions here as well. We do have to wrap it up, certainly for the Facebook Live feed. I don't know if any of our speakers are able to stick around for a little while after to address some individual questions, but I think we'll actually have to, in terms of the group responses, we'll have to call it there for now, and just thank all of you for attending today, for sharing your stories and your questions with us, for listening to our speakers, and thank you very much, all of you, for sharing your expertise. Dr. McDougall as well, for participating from Halifax. Thank you again to our sponsors, Aphria, for making this event possible. We couldn't have done this ourselves, so a big thank you to them. And the questions and the conversation doesn't have to stop here. You can visit our Facebook page at Arthritis Society and ask questions there. We can get back to you there. Those of you who can stick around, we may be able to have some conversations here after as well. Thank you very much for coming. Thank you for your support. Please do make sure to fill out the surveys here and hand them in to the folks in the blue t-shirts. The more you tell us about what you're looking for from the Arthritis Society, the better chance we have to deliver it. Thank you very much. Have a great night.